will be talking about high-risk pregnancy. Unfortunately, 5 to 10% of the pregnancies in the current day are turning high risk because of a lot of pre-existing factors. There are certain pregnancy-specific factors, and there are factors which are aggravated by pregnancy. Some of them are preventable, and many are not. As we go around, we'll be talking about them, and then we'll be having some discussions so that we clarify the points where we do not have questions unanswered still. So the increasing incidence, one reason is late marriages. There are many patients who are not only marrying late, there's an increasing incidence of people who are unable to conceive. That is, we call them infertility. And when we give treatment for infertility and the patient conceives, that becomes a high-risk pregnancy. The other reason for the increased incidence is because of so many lifestyle disorders, which are currently increasing every day because of stresses of life, overweight, that is we call obesity, diabetes, hypertension, smoking, drinking, and so many drugs which are taken advertently, knowledgeably, and inadvertently, which all increase the risk in a pregnancy and hence puts it into a high-risk category. The single most important factor which is changing is the age. In rural areas, we have a high incidence of teenage pregnancies, which are pretty much at risk. In urban population, we are having the other spectrum when we have patients with very increasing age pregnancies. So less than 18 years is also at risk, more than 30 is also at risk. The teenage, we have more incidence of deficiency of hemoglobin. The bones are getting remodeled and the lady gets pregnant, which causes changes in the bones. Hence, the bone remodeling and related problems start increasing. With stress for a young girl who's becoming a mother, less than 18 years of age. Sexually transmitted infections are commoner in this age group, and we have more incidence of operative deliveries because of smaller bones and thin girls with the low BMIs. The elderly gravida poses more risk to herself as well as the baby who's going inside because of more pre-existing conditions. Most of them have been treated for infertility. They have the more chances of multiple pregnancies if they are treated for infertility. There are more and more patients who will have fibroids which are of reasonable size by the time they are pregnant. There are higher incidence of abortions, abnormal babies, smaller babies, premature babies. The high BP, blood sugar, and medical problems aggravate in pregnancy. There are higher chances of deliveries by cesarean sections and other complications related to anesthesia and surgery. And there are higher chances of a bleeding problem in patients who have hypertension and obesity after the delivery. The medical disorders are there from beginning to the end, but extremes of ages as a risk factor, even otherwise, unfortunately, about 60 to 80% of the girls in different studies, even in the urban, well-educated, belonging to reasonably good socioeconomic status, also have low hemoglobin and weak bones that we call osteopenia, even in childbearing age. We have ladies suffering from thing to be considered because so many pregnancies occur which are unplanned. There are abortions which are done even medically and surgically without knowing the blood group. And if the girl is Rh negative, it poses problems. Pregnancy is a great risk factor for a future pregnancy. Heart diseases also is not a rarity in think about 1% of the patients have heart disease and they're pregnant. And heart disease with pregnancy is a very high-risk category pregnancy and needs to be really looked after very well. Epilepsy, that is the convulsions, about again almost 1% of the population. Thyroid disorder is alarmingly high incidence. It's almost 1 in 10 Indian females at this moment are having some kind of a thyroid disorder in pregnancy. Bronchial asthma. And the last but not the least is the patients who are diagnosed with cancers early in life, and these cancer survivors also have a chance of pregnancy after in a very different spectrum. So cancer survivor pregnancy is again very high risk and very high specialized pregnancy. Now the pregnancy specific factors. So the previous pregnancy ended up in what? Determines a lot as to what we are going to look after in this pregnancy. A patient who has a history of abortion, a previous pregnancy which occurred outside, as we call ectopic pregnancy, a baby dying inside the mother's womb, a birth of an abnormal child, then history of a small baby or a premature delivery increases the risk of repeating the history in this pregnancy. There are more and more patients who are ending up in cesarean sections because of different medical reasons and even social reasons in first pregnancy. And a pregnancy with a scarred uterus belongs to a high-risk category. Whether the scar was because of cesarean or even patients who have had fibroid removal by is again high-risk category. But these are pregnancies. In the current pregnancy, when the and we see the patient as to what we are dealing with in this pregnancy. So the present pregnancy, if it's an IVF pregnancy, if there are multiple babies, that's a twins, generally we talk about. History of fever or an infection or a bleeding the first 3 months. History of drugs, which the patient was already taking before pregnancy or she has taken in her first visit to the doctor. An inadvertent X-ray exposure in the first 3 months. A low-lying placenta, or thinking about uncomplicated pregnancy and we do the ultrasound, we find a placenta is low-lying, and we pick up something wrong on the scan, converts a low risk into a high risk. So, suspicion of an abnormality on the scan, a sudden rise of blood pressure, a sudden variation in the blood sugars, abnormality in the liver function tests, a high-grade fever, or a premature labor converts this absolutely normal low-risk pregnancy into a sudden high-risk category, and we need to keep our eyes and ears open for this. So when it comes to management of high-risk pregnancy, as holds true for all parts of the medical care, prevention is better than cure. And that is the importance of categorizing the pre-existing factors, which can be, to some aspect, can be modified so that we have lesser complication in a high-risk pregnancy population. Preconception counseling will go a long way to prevent pregnancy complications. If the patient is overweight and we make her reduce weight before she conceives, the high-risk pregnancy category can be brought down to a low-risk category. The same holds true for correction of anemia and calcium deficiency. Finding out if the lady is Rh negative. Of course, doing a pap smear before the lady is pregnant to pick up any cervical pathology, which is a very important health concern in the Indian scenario, also is a part and parcel of the preconception counseling. A lady who is not immunized against rubella should be vaccinated before she is pregnant. As many of you might be aware, if a pregnant lady contacts a rubella infection in pregnancy, it can lead on to birth of a child born with hearing deficit or even blindness. So rubella vaccination are two things which must be known by every lady before she contemplates her first pregnancy. She should also be aware about the safety of the drugs that the patients who are in category of antihypertensives. And we know there are certain antihypertensives which are contraindicated in pregnancy. So if the lady visits a doctor before she contemplates pregnancy, we can shift her into drugs which are safe for pregnancy. So prevention is for factors which are so common, so easy to treat, so important, so rewarding, but unfortunately so ignored, as we already talked about, like overweight, anemia, osteopenia, and cervical cancer prevention we are talking about. So these prevention strategies must be given to everybody so that you have less and less number of patients going to high-risk categories, which increases the risk of pregnancy to the mother and the child birth. So the management starts with the first visit. We should take a detailed history that holds true for the family history, past medical history, any surgeries, and as I talked about, the history of previous pregnancy detail to see what complications are we anticipating in this pregnancy. And there should be a medical examination form to find out any high-risk factor which the patient was unaware and you have picked it up. And if we find a high-risk factor, then she should be booked in a high-risk unit if we find factors which will be shifting her into a high-risk category. So once we pick up this patient as high-risk, then we should talk about counseling, which should be of the couple as well as the family. The family should know at what stage, and if we are talking about high-risk units, if we are sitting in a center, we are sitting in a place where there are no high-risk categories, it's important for the treating doctor to decide as to when this patient should be referred to a unit which is specialized in taking care of these things. It's not possible for any individual doctor to be looking after everything. Let's say if you're talking about heart disease, we need a cardiologist. If you're talking about a patient who has a bronchial asthma, we need a chest specialist. So we should be talking about a high-risk category. The patient should have a back so that in case things go wrong, we should be in a position to treat at the right time. So it should be tailor-made frequent visits. There are specifications. When we see something is wrong, we need to call the patient early to show us the reports. Other than routine pregnancy, maybe 10 visits, 1 in each trimester, then 2 in second trimester. And that paradigm does not hold true for a high-risk category. So the pregnancy must be taken care of. All pregnancies require a Medicare. We should interpret the reports right. And as and when required, a multidisciplinary care is the thing which is required in this high-risk category. We should have a medical specialist or a surgical specialist referral as and when we feel the need. A neonatologist consultation should be done much before delivery so that the pediatrician knows as to what problem we are anticipating. The patient is a previous premature baby, or the patient has had a previous baby who are very small and required ventilation. The pediatrician should be prepared to look after this baby if the premature delivery is anticipated or comes as a hope for the and a team effort so that the patient does not suffer and we are able to deliver the care which is desired. High-risk pregnancy care unit should be a dedicated team of highly skilled doctors, and we should have multiple specialists, an obstetrician, with assured 24/7 cover 365 days a year. And services of the obstetrician, of the dietitian, that's a neonatologist, ancillary specialist, anesthesia, surgeons, and physicians should be available if we are willing to take commitment of a dedicated high care pregnancy unit. We should have well-equipped labor room suites, operation theatre, and a neonatal nursery, which is available 24/7. So we'll be talking about some risk factors, and we're talking about the carry-home messages. Each word is to be taken in its own spirit. Every pregnancy is precious, with expectation for good outcome. So I think I said in the beginning, we can't determine which low-risk patient suddenly becomes high-risk. And which the patient, when they start becoming high-risk, you should not scare the patient. At the same time, the patient should know that now things are not the right way. They should be told the importance, okay, how much time it's going to take for her to reach how much time it's going to take for her to reach backup available at home. Everything should be given in